1 year ago today, Governor Ducey declared a public health emergency. And at the time, we had just 9 COVID cases and not a single virus-related death. A full year later, more than 830,000 Arizonans have now tested positive for COVID. 16,464 Arizonans have lost their lives. And these are not just numbers. These are parents, brothers, sisters. These are our friends. And there are signs of life, that life is beginning to return to normal in some ways for many of us. Restrictions are now being lifted, and we're all ready to put this pandemic behind us. But COVID nurses, they cannot look away. Jared Dillingham spent a shift with the ICU nurses dealing with the most severe cases. Jared, I am dying to see this story.
Well, Brandon, you mentioned hospitalizations are going down, so there is encouraging news coming from most of our hospitals. Valleywise allowed us in, and some of their COVID floors are now closed, back to normal. But the nurses who have been dealing with the sickest patients for a full year now wonder if they will ever be able to return to their normal. Streamers and colorful paint brighten this unit, but these are dark days in the COVID ICU, which used to be a children's wing at Valleywise Health in Phoenix.
It's just a lot of stress, constant stress.
It's just all awful.
It's insane. It's insane.
Constantly for a year now.
1 year ago, the unit's rainbow decor turned industrial. Ducting was brought in to create negative pressure patient rooms to suck the virus-tainted air out. The reality is, despite advances in treatments, most patients who arrive at the COVID ICU do not go home.
These people are coming in so sick, it's almost like you can almost predict when you look at them how long they will be around, because they're so sick and they go so fast.
It is not from a lack of passionate care.
Could you get me another warm blanket, please?
Jeremy Nagu left construction for nursing 7 years ago.
Do you think people understand what your year has been like?
No, absolutely not. It's not just the hours. I mean, hours are easy to work. You know, it's just the emotional drain, going home and just crying. You know, it's holding people's hands when they pass here. You know, when they can't even see their family members, and knowing what their outcome's going to be before they even reach it. You know, and it's devastating.
We watched him suit up to attend to a patient who's been here for about a week.
You gotta go bathroom?
He checked his IV, delivered shots of a clot preventer and insulin, and asked him to flip over.
I need you to lay on your stomach again, okay? We'll help out with your lungs.
This patient was alert, able to talk, and mostly move on his own.
All right, call me if there's anything you need, okay?
So, Jeremy's assessment caught me off guard.
He's not going to make it out of here.
He explained the man has COVID pneumonia and fluid in his lungs.
Based off of history and what I've seen, like I said, I work ICU. I see the worst of the worst. I don't get to see the ones that go home. He's in the ICU. I expect the worst, especially based off of his lab work.
But I see him moving around, but you're saying what's going on inside his body is the indicator, not what I see physically, him moving around in his bed.
Correct.
Doctors come through the ICU to check up on the patients.
And his x-rays getting worse.
But it's the nurses who spend all day, every day with them, getting to know them. Jeremy tends to patients here and on a reservation, a workload that took me a moment to fully grasp.
I was doing 7 days a week for, I think I did 151 days in a row with 2 days off before I took a couple of weeks off.
How many days was it?
151.
In a row? Why would you work that many days?
Who else is going to take care of them? We're short-staffed here. You know, it's just like, who's going to take care of them? And you just have this guilt being home.
He did recently spend time at home. His father-in-law just passed from complications of COVID-19. Sadness seems to have compounded over the year, weighing on the nursing staff, escaping in brief bursts of anger or frustration over issues like people not wearing masks.
I feel like the world is delusional sometimes. Like, don't you see what's happening here? We see it every day.
And people who dismiss COVID as only affecting the elderly.
That statement makes me so angry because it makes it seem like they don't have value. Like, people in that population don't have value, and those people have value. They belong to someone. They're someone's mom or grandma.
Humor is used to cut through the sadness here, along with small acts of kindness for each other.
Jeremy gets me a soda every afternoon, and that's like, you know.
It sounds so simple.
It's so simple, but it's like he takes the time to like know what kind of soda I like, and he brings it to me, and it's usually around 2 o'clock in the afternoon that it shows up, you know. And
Why does that matter?
because someone's taking care of us.
And taking care of our nurses, their mental health, is something hospitals are having to address.
It has absolutely taken a big piece of me, and who knows what kind of PTSD we're going to have, like legitimate. I mean, it's a war, it's a different kind of war, but it's still, we're on the battlefield, we're seeing people die daily, multiple people die daily, and that's not sustainable for a healthy mentality for us.
Some of their colleagues left nursing this year, but the crew on this shift seems determined to outlast the dark days of this pandemic.
I don't want to do another year of this, but I don't have any intention of going anywhere.
Sadly, they just recently lost one longtime nurse to COVID. She was coming up on her retirement. Each nurse I talked to expects another surge in cases in the weeks to come because of spring break, lifting restrictions, and general COVID fatigue in the public. Brandon, I do want to thank Valleywise for allowing us in to follow their nurses around.
I was just going to say, Jared, thank you, and thank you to Valleywise for inviting us in to give us that perspective of what these doctors and nurses are facing on a nightly and daily basis. So they've been doing that for an entire year. Did you get a sense that they're either seeking help themselves or seeking therapy, anything for their own mental health?
Each one is doing a different kind of therapy, and Brandon, each one seems to have a different outlet. Like one of them, Jenny, in that story, she has a dog that needs a lot of training, so she's spending a lot of time with the dog. I met a traveling nurse who's here from Scotland. He seemed to be traveling all over the state, seeing different parts of Arizona. That's his outlet. It seems like everyone is doing something different, and they all seem to say that talking to each other about what they've gone through seems to help the most.
Well, I know I can speak for everyone here at Arizona's Family. We appreciate all of the hard work that they have been putting in those hospitals day in and day out. Jared, thank you for that report tonight.
Sure.